like to talk about PCOS and insulin resistance. So if you have PCOS, many times you might be told, well, let's just lose weight and everything will be fine. But really, we have to address insulin resistance, which is the most important cause of PCOS. So it's not always just people who are overweight who have PCOS. Other people have PCOS who are thin with this condition, and therefore insulin resistance is the dominant hormonal abnormality. We have to deal with that if we're going to be able to get to the bottom of the situation with PCOS. So PCOS is referred to as Polycystic Ovarian Syndrome. And so one would think that if they had a polycystic ovarian syndrome, they would have cysts on their ovaries. But in reality, not everyone who has polycystic ovarian syndrome has ovarian cysts. And this is because it's really a hormonal problem. It's an insulin resistance problem. And so there are patients who have this syndrome, which again is not a specific diagnosis, but has multiple different components. And that's why it's confusing sometimes to understand, but wait around for a little bit and I'll go into more detail. If you have PCOS and you come to an endocrinologist like myself, here's a common way that this would be approached. So one thing we would do would be we'd obviously do the physical exam. We'd look for some of the symptoms, which include things like acne, hair growth, weight gain, things that were more related to elevations in the testosterone in relationship to estrogen. And then, of course, a lot of people with PCOS have irregular menstrual cycles. So these are all the components, and it doesn't mean that you have to have all of them to necessarily have PCOS. You can have just some of them. But once we determine that you most likely have PCOS based upon these criteria, then we go into some laboratory evaluation after physical exam, as I said. And the laboratory evaluation would be things like measuring a fasting insulin level, a fasting glucose, maybe a hemoglobin A1C, an insulin level, testosterone level, and oftentimes FSH and LH. These are pituitary hormones. And finally, another adrenal steroid that we call DHEA sulfate. So there's a number of different tests that one can do when people present with this question of my periods are irregular and I've been told I have PCOS. In PCOS, we have multiple different ways to approach the condition. If people are overweight, then we have treatments for overweight, but certainly we always look at dietary and lifestyle issues initially. And then we have treatments, and some of the medications that we are now using for people for weight loss have been successful in patients who are overweight and have PCOS. Now, of course, we have to be careful if individuals are interested in getting pregnant. We typically do not use any of these medicines that are commonly referred to these days as the GLP-1s in someone who is interested in pregnancy or pregnant themselves. The second thing that we have to offer, we have medications that are oral medications, depending upon what the individual is interested in doing. So, for instance, if someone is not interested in having children at the time and is interested in having more regular cycles, then some of these individuals will go on birth control pills, oral contraceptives, in order to maintain a normal cycle, have monthly menstrual cycles, which are then considered to be adequate in terms of the estrogen. And again, what we're trying to do is in PCOS, there's an increased amount of testosterone as a result of insulin resistance in relationship to estrogen. And so we're trying to balance those out to make the likelihood of having periods more regular as a result of having more estrogen. And so that's how birth control pills work in patients who have PCOS. Now, the other treatment options would be a treatment for if one is interested in getting pregnant, then there's been some benefits with using a medication called metformin. Metformin has the ability of decreasing insulin resistance and oftentimes will result in regular periods and conception. So metformin is a medication that's used for diabetes, but in this case, it's used in PCOS because it has this impact on decreasing insulin resistance. So that's another option. But of course, that also has the potential of a woman becoming pregnant. If her cycles become regular, she becomes fertile, and that's an option. And then we also use some drugs that have been used in situations where people are looking to decrease their hair growth. There is a drug that is actually a diuretic used in patients who have a particular blood pressure issue called spironolactone or aldactone. That medicine has an impact on hair growth and can be beneficial. But we always want patients who are on that drug to be carefully monitored on birth control pills because we don't want a side effect of that medication to be evident in a woman who became pregnant and had a child in that situation. That's sort of the treatment, at least options that people have done. But I would say that that's fairly standard in the US as far as what is available currently.